This is a video demo of wound tracing and surface area measurement. So we made tracings of the structures in the ham hock. We have the bone, the muscles, our necrotic tissue, including the connective tissues and the fat. So we made measurements a while ago too. And this is right here. We have the date, patient's initials, the orientation are 12 o'clock and the 6 o'clock position. So I made measurements a while ago directly from the ham hock using the centimeters of our wound tracing device, getting the longest measurement, and directly I got 3.6 centimeters for the length, and for our greatest width it's 2.3 centimeters. So I put it down and the surface area is 8.28 square centimeters directly from the ham, and measuring using the tracing. My greatest length is at 3.5 and the width is 2.4 centimeters, and the surface area, which I listed here, is 8.4 square centimeters. This is our baggie with the bone, muscles, necrotic tissue, got fat in there, and connective tissue, list the date, the name of the patient, clock orientation, and the surface area measurement. Also notice the discrepancy with our measurements. Directly I have 8.28 square centimeters, and with the tracing I have 8.4 centimeters squared, which is a difference by 0.12. So with real patients we must be consistent in our measurements, whether on the baseline you use the direct measurement, or so on your succeeding measurements make sure you use that measurement for consistency. This is a video demo of callus shaving or paring. For this procedure we use the number 10 scalpel, and for proper handling of the scalpel we use it between the third and the fourth finger, with the rest of the fingers wrapping around the scalpel along the serrated area. Okay. So the forearms should be stabilized on the surface, on the table. And to make the first cut, the blade is angled slightly to make the first cut. And then ensure that the blade is flat and do sewing motions. Okay, we're still doing the shaving. Okay, this is my first fleck right here. A while ago I think my first cut was a little too deep, so I got that lighter shade of purple right there, but I think it's still non-viable tissue there. So we continue doing our sewing motions, ensuring our forearms are stabilized. Look. Okay. So this is one of the flecks that we have paired a while ago. And this is our finished demo. I believe that the callus, most of it have been paired. And we stop because we don't want to go too deep to the viable tissue. And as I would like to point out, the first cut that I made, I think is a little too deep. It's still not showing viable tissue though, but it's very light compared to the rest of the callus. So this is the video demo for shaving or pairing of the callus using the number 10 scalpel blade. Okay, video demo for cross-hatching scoring. For this technique, we will be using the number 15 blade. And proper handling of the scalpel, you hold it like a pencil in the first web space. So the rest of the finger wraps around the scalpel, around the serrated portion. And for cutting, the curved part of the blade should be used and not the tip. Okay, the forearms rest on the table. And we shall be doing our first cut. We first make our parallel cuts Okay, so we use the curved part of the blade. Okay. Okay. Alright. These are the first parallel cuts. I think we did a good job in making our cuts, as we don't see any viable tissues, or what the white part of the hem hack is not showing right here. So then we will make the perpendicular cuts to complete the technique. Okay, we use the curved part of the blade, arms on the table, scalpel held like a pencil. Okay, let's check. Alright, I think we made good cuts right here. No white part, no viable tissues is exposed. So this is the technique of cross-hatching or scoring of an eschar. Okay, video demo for sharp debridement using forceps and scissors. For this technique, the scissors is held on the dominant hand, which is my right, and the forceps on my non-dominant hand. So proper handling of the scissors: thumb on the first scissor ring and the ring finger on the other ring. The middle finger can stabilize too, and index finger using 3-point fixation, it should be on the shaft of the scissors. And the forceps on the palmar surface on my non-dominant hand. So very important, the forearms are resting on the table, and when making cuts, the scissors should be angled upward and away from your patient, from the hook. So we use the forceps to pick the non-viable tissues and make our cut using the middle portion of the scissors. So we put our snippings there. Okay, the white part there is, I think, connective tissue in between the muscle. It's not a viable tissue. Okay, I think there is starting to show some viable tissue there, so I'll stop right there, go to some portions. Okay, so after a few minutes of debriding the hog, I decided to stop because I think and I believe that I'm seeing a lot of viable tissues now. So it's very important for the clinician to stop the procedure when the majority of the non-viable tissues have been debrided and you're seeing a lot of the viable tissues. So these are the snippings from the procedure. The blue tissues over there are necrotic tissues, and this is how the ham hock looks after the procedure. So most of the necrotic tissues have been removed and the viable tissues are already showing. So that ends the presentation for sharp debridement using forceps and scissors.